Hello everyone, I am Arya Roy. I am an assistant professor of breast medical oncology at the Ohio State University. I'll be discussing about antibody drug conjugates and the side effects of antibody drug conjugates. Let's see what are antibody drug conjugates. You may hear this term when you have a diagnosis of cancer, and if you are going to see a provider, they will be discussing with you about chemotherapy, immunotherapy, targeted agents, and they may be discussing about antibody drug conjugates as well. So you need to know what antibody drug conjugates are. We call antibody drug conjugates as ADCs. So ADCs are a type of cancer therapy that combines a monoclonal antibody with a chemotherapy agent. So antibody drug conjugates or ADCs are designed to deliver the chemotherapeutic agent or the drug that is attached to the antibody drug conjugates directly to the cancer cells so that they can minimize the damage that happens to the healthy cells. Let's look in detail about the mechanism of action of antibody drug conjugates. As I mentioned earlier, antibody drug conjugate is a combination of a chemotherapeutic agent or a chemotherapy with a monoclonal antibody. And we know that usually when we give a chemotherapeutic agent, most of the time we have a lot of side effects because this chemotherapy agent is not going to act at a particular target in a particular cell. Instead, they are going to act all the fast growing cells in our body. And that's how most of the side effect happens. But in terms of the antibody drug conjugates, its mechanism is a little bit different because it is designed to particularly attack the specific cells which has a specific antigen or a target, and then it will distract only that particular cell so that it will not cause any problems to the neighboring cells or to the other normal cells. Let's see how they do that. As you can see in this figure, the first one here is an antibody drug conjugate. So you can see that it has a monoclonal antibody, and then it has a chemotherapeutic agent which is attached to the monoclonal antibody with what we call as a connection or a linker. And you can see that this is a cell. This is a representation of a cell. And you can see that there is a green marker on that cell, which represents a targeted antigen or an agent that this particular antibody drug conjugate is going to target or attach to. So when we take this antibody drug conjugate, it goes into the cell, it goes into the body, and then it will go and find all the targeted agents for which they are designed to attach to. And once it is attached, then the antibody drug conjugate gets inside the cell. We call this as internalization of antibody drug conjugate. So you can see in this figure that the antibody drug conjugate is coming and it's going to attach the targeted agent. And once it's attached to the target, it goes into the cell. And once it's inside the cell, then the linker agents or like the linkage that will break, and then the chemotherapeutic agent that is attached to the antibody drug conjugate will be released inside the cell. And so the chemotherapy will be released inside the cell, which leads to the destruction of that particular cell. So that is the main mechanism of antibody drug conjugate. And in some cases, there is a particular other mechanism called as bystander effect, which means that even though this antibody drug conjugate is destructing the particular cell in which that chemotherapy agent is released, sometimes it gets out of that cell and then it actually goes and distracts the neighboring cells which doesn't have that antigen. So this is also important because as we can know that when in terms of a cancer or a tumor, there are so many cancer cells are seen together. So when this antibody is going to attach to that particular antigen, the chemotherapy agent is released inside that particular cell which has the antigen. But at the same time, it can also leak a little bit into the neighboring cells or the neighboring cancer cells, and it can distract the neighboring cancer cells, which is attached to the main cell in which the antibody drug conjugates are attached to. So that is called as bystander effect, which is another mechanism by which the antibody drug conjugates are acting.